Hello, are you Heather? Okay, my name is Seth, and I'm a nurse practitioner. I'll be taking care of you today, okay? So what brings you in today?
I'm here for
You're here for physical, okay? So if you did come in with something, Heather, or with a chief complaint, we would go ahead and use old cards for you. So onset, location, duration, characteristics, aggravating factors, relieving factors, temporal factors, and severity of symptoms. I'd also ask you if you've taken any medications at this point, whether it be over the counter or prescribed, and then if you've had any treatments up to this point. Okay? All your information is confidential between us. Do you have any questions before I begin? Okay. So what first we're going to do is we're going to go over some past medical history with you, okay? So have you had any childhood illnesses or adult illnesses?
No.
Any hospitalizations?
No.
Any surgeries?
No.
Ever been hospitalized or treated for substance abuse or anxiety or depression?
No.
Okay. Have you had any blood transfusions?
No.
Are your immunizations up to date?
Yes.
Have you had any flu shots?
Yes, this year.
Okay. Do you take any medications over the counter or prescribed? Do you have any allergies?
No allergies.
Okay. Next, we're going to go over some family history, okay? So, are your parents still alive?
Yes.
Okay. And do you have any siblings?
Yes.
Okay. Are they still alive? Okay. Do you have any children?
No.
Next, I'm going to ask you, are your paternal grandparents still alive?
No.
And maternal grandparents?
No.
No? All right. Well, I'm going to just talk about some major illnesses, and if any of these major illnesses your families have had in the past, or you know of them, just go ahead and let me know. That way we can include in your family history, okay? Any respiratory problems, such as asthma or COPD?
No.
Okay. Any cardiovascular disorders, heart attacks, strokes, hypertension?
No.
Okay. Any diabetes mellitus?
No.
Okay. Any liver or kidney diseases? No. All right. Any cancer?
No.
Any genetic disorders?
No.
No. All right. Next, I'm going to start going over some social history with you. Okay. What do you do for a living, Heather?
I'm in the military.
Do you feel that your financial needs are met by your occupation?
Yes.
And what does your diet look like, Heather?
Whole foods, I eat like 3 times a day, not twice.
Okay. And do you exercise regularly?
Every day.
Every day. And do you use any tobacco at all, or do you drink or use any recreational drugs?
No.
No. And do you have any cultural or religious background or practices that might affect your care?
I'm Catholic, but nothing that would affect my care.
Okay. Do you have a sexual partner, or are you sexually active? Okay. And how many sexual partners do you have?
Just my husband.
Okay. And primary support at home?
Is my husband.
Okay. And is that who you live with? Is just your husband? All right, Heather. Well, I'm going to go ahead and start a review of systems with you. So I'm just going to go over your body systems with you, just checking for if we can see any abnormalities, okay? So have you had any recent weight gain or weight loss? Any fevers or chills at night?
No.
No. Have you had any sudden moles, rashes, irritations in the skin at all that might come up? No. Any recent hair loss at all? No. How about your vision? Have you had any decreased vision, any double vision at all?
No.
Do you wear any contacts or glasses?
I wear both.
Both? Okay. And have you had any dizziness at all, or headaches, or loss of consciousness?
No.
No? Okay. And how about hearing loss or ringing of the ears?
No.
Any discharge at all?
No.
Okay. And do you wear hearing aids?
No.
No? And have you had any gum bleeding or difficulty swallowing at all?
No.
Any nasal congestion or nasal bleeds? No. And how about joint stiffness, muscular, anything muscular or joint as far as stiffness or weakness? No. And we're going to skip the breast exam, okay? But have you had any chest pain or maybe heart palpitations at all?
No.
Any swelling in either calf? No. Any difficulty breathing either with exercise or at rest?
No.
Any congestion? Are you regular with your bowel movements? Okay. And have you had any abdominal discomfort or abdominal pain? No. Have you had any difficulty urinating or maybe urgency urinating, leakage, discharge possibly? No? And are you, or have you had when was your last menstrual period?
2 weeks ago.
2 weeks ago? Okay. Any increasing cramping with that at all? Or abnormal discharge or more than regular?
No, it's pretty normal.
And have you ever felt hopeless in the last 2 weeks? Maybe not as interested in activities or thoughts of hurting yourself or others in the last 2 weeks? No? Okay. All right. Well, Heather, next what we're going to go ahead and do is we're going to go ahead and move on to the actual exam. Okay, do you have any questions before we get started? No? Okay. All right. Well, I'm going to go ahead and touch your head, okay? I'm just going to go ahead and feel your head. Any pain?
No.
Okay. Now I'm going to go ahead and feel your frontal sinuses, okay? Any pain at all? And your maxillary sinus? Any pain?
No.
All right. Now I'm going to go ahead and feel your lymph nodes, okay? Have you had any soreness in those lymph nodes? No? Okay. I'm going to feel the occipital, your postauricular, your preauricular, your parotid, your submandibular, your submental, your postclavicular, and your anterior clavicular, and then your superior clavicular, supraclavicular. No nodules at all that are palpable, so that's what I'm finding, okay? So next what we're going to do is I'm just going to go over your eyes with you, okay? So what we're going to do is I'm going to go ahead and assess your eyes, and I'm going to use the pin light just to shine it in your eyes, okay? So just go ahead and look straight ahead for me. Okay. And your eyes, your pupils are round, reactive to light, okay? And next what we're going to go ahead and do is I'm going to go ahead and use the scope to actually look in your eye, okay? So I don't have a scope to use, so I'm just going to use my hammer and act as if it was a scope and do the eye exam. So I'm going to go ahead and have you look straight ahead for me. Okay? And I'm going to go on the other side. Now, what I should find if the patient is normal is her optic disc should be a pearly gray. There should be no leaking or hemorrhages of the blood vessels, and her red light reflex should be present on both sides. Okay, and in this exam, it is a normal finding. Okay, so next, Heather, we're going to go ahead and move on to your nose. Okay, so I'm just going to go ahead and touch your nose here. Any pain at all? No. Okay. Now, what I'm going to have you do is I'm going to have you occlude one side with one nair with your hand or finger, and I'm going to have you breathe out and in. Perfect. And then the other side. Perfect. Now, again, I don't have a scope to look in her nairs, but I will use this to demonstrate. And I will look in. Perfect. And her membrane is pink and moist and appropriate and without deviations. All right, Heather. Now at this time, I'm going to go ahead and look in your ears. Okay. So again, I'm going to use this as a demonstration for it. But first, I'm going to go ahead and feel your ears. Any pain at all? No. All right. I'm going to go ahead and look inside, and I'm going to go ahead and pull up and back. Look again. All right. I'm going to switch to the other side. Okay. Now, the normal findings for this patient, if it was normal, would be a tympanic membrane that is a pearly gray. The umbo I would be able to see, the malleolus I would be able to see, and the cone of light I would be able to see. And there would also be a minimal amount of cecum on both sides. Okay. So next what we're going to go ahead and do is I'm going to go ahead and fill your throat here. So I'm going to go ahead and touch it. Okay. Go ahead and swallow for me. And I can see that her trachea, prior to her sitting in the chair, it was midline. So I can see that. I'm going to go ahead and move the thyroid a little bit there for me. All right. And I'm going to go ahead and test a couple of the cranial nerves at this point. I'm going to go ahead and test cranial nerve number number 9, cranial nerve number 10, and cranial nerve number 12. Cranial nerve number 9 is your glossopharyngeal. Cranial nerve number 10 is your vagus, and cranial nerve number 12 is your hypoglossal cranial nerve. So what I'll do is I would use a tongue blade, and I'm going to have you stick out your tongue, Heather. I'm going to look inside and say ah, and I'm observing the uvula to make sure that it is midline. I checked her gag reflex. It is present. She gagged when I placed the tongue blade in her mouth. And at this point, I'm going to have her, if you want to go ahead and open your mouth, stick out your tongue, and go from left to right to up and down. Perfect. And what I'm going to do is I'm going to place my hand against your cheek, okay? And what I want you to do is you press your tongue against my hand. Perfect. Okay, great. Next, what we're going to go ahead and do is I'm going to go ahead and assess cranial nerve number 7, that is your facial nerve. So I'm going to have you pop out your cheeks for me, smile real big for me, frown, and then lift up your eyebrows. Okay, perfect. And that's cranial nerve number 7. And we're going to go ahead and assess cranial nerve number 5, that is your trigeminal nerve. And for trigeminal nerve, what I'm going to have her do is I'm going to have you clench your jaw, and then I'll fill your jaw. Okay, great. All right, and what I'm going to go ahead and do is I'm going to go ahead and continue to assess cranial nerve number 5, which is to include touch and sensation. So I'm going to go ahead and have you close your eyes. I'm going to touch you with something either sharp or something soft, and I need you to let me know which one it is, okay? Okay, great. You can open your eyes, Heather. Okay. At this time, I'm going to go ahead and assess cranial nerve number 2. And cranial nerve number 2 is her optic nerve. And for her optic nerve, I'm going to go ahead and have her read our Rosenbaum chart, which I do have. So with this Rosenbaum chart, Heather, what I'm going to have you do is include one eye. I'm going to have you read the smallest letters that you can, or numbers, back to me, okay? So if you want to go ahead and include one eye for me.
3, 7, 4, 2, 5, 6.
Great. And you can include the other eye for me. And go ahead and read it back to me.
6, 5, 2, 4, 7, 3.
Okay, great. And Heather, you do have 20/20 vision. All right. Moving on, I'm going to go ahead and do the confrontation test for you. So Heather, what I'm going to have you do is include this eye for me as I'm over on this side. And let me know when my fingers come into your peripherals, okay? Okay, we're going to switch over to the other side. Okay, and that assesses for cranial nerve number 2. All right, next we're going to go ahead and assess cranial nerve number 8, which is her acoustic cranial nerve. So we're going to go ahead and do a couple things. The first thing I'm going to have her do is, Heather, I'm going to have you, as soon as you can hear my fingers, let me know, okay? So, should hear a whisper sound. Okay. And on the other side. Perfect. All right. Next, what I'm going to go ahead and do is I'm going to use our tuning fork. And I don't have a tuning fork, so I'm just using a fork. So with this tuning fork, what I'm going to do is I'm going to hit it, and I'm going to place it at the center of your head. And what I want you to do is tell me if it's equal bilaterally as far as the sound. Okay. Okay. All right. And next, what we're going to do is a ready test. And what I'll do is I'm going to hit it. I'm going to place it behind your ear. Let me know when it stops, and then I'm going to move it in front of your ear. Okay. And also then let me know when it stops. All right. And the other side. And air conduction is twice as long as bone conduction, so that is a normal finding. All right. So next what we're going to do is I'm going to assess your cardiovascular system. Okay. So I'm going to go ahead and listen to some sounds. All right. I'm going to listen to your aorta or aortic valve. pulmonic, Erb's point, tricuspid, and mitral. Most of them listen through some forced roots. And they were not present. All right, next what I'm going to do is I'm going to listen to your lung sounds, okay? So I just need you to breathe normal for me, all right? Now I'm going to listen to your sides, all right? Okay. Now I'm going to listen to your posterior sounds. So if you can get up just so I can show where I'm doing my posterior sounds. Perfect, right there. All right, great. Go ahead and sit back in the chair. And all your lung sounds were normal, okay? I would also be able to assess cranial nerve number 1, the olfactory nerve, with 2 different types of cells, but we don't have to do that for this exam, so, which is cranial nerve number 1. All right, so at this point, we're going to go ahead and move on to the abdominal part of the exam. So I'm going to have you lay down on the couch before I lie down on the couch for me. And I'm going to have you lift up your shirt just to show the abdomen. Now I'm going to listen to some sounds, okay? So at first I'm just going to inspect the abdomen, making sure that there's no bulges or masses or hernias. And then Heather, I'm going to have you raise up your leg, or your head. Perfect, all right? And no bulges or masses or hernias were noted. Vowel sounds were present, and they were less than 5 seconds. All right, Heather, next what I'm going to do is I'm going to listen for some bruits, okay? So first I'm going to listen for the aortic, renals, iliacs, and then femorals. And they were not present. Now what I'm going to do, Heather, is I'm going to do some light palpation, okay? Now Heather is pregnant, so I won't be able to do very deep palpation, nor will I be able to do deep palpation of the organs. However, I will talk through it. So some light palpation first. Let me know if there's any pain. Any pain? All right, next I'm going to do deep palpation. And then I'm going to palpate the epigastric region and the umbilical region. Any pain? Okay. All right, at this point in time, I'm going to go ahead and palpate or deeply palpate some organs. So Heather, what I'm going to have you do is I'm going to slide my arm underneath your back, and then I'm going to deeply palpate the liver and the gallbladder. So Heather, I'm going to have you breathe in for me, and on exhale, I would deeply palpate, feeling for the liver and the gallbladder. I would then repeat this by going down to the kidneys, waiting for her to inhale, exhale, deeply palpating for the kidney, and then on the other side as well, deeply palpating for the kidney, and then deeply palpating for the spleen. So inhale, and then exhale. On exhale, I deeply palpate for that spleen. All right. And then on my exam, it's a normal finding, so I wouldn't find any enlarged spleen, liver, gallbladder. So at this time, Heather, you can go ahead and get up. Come back to the chair here. Okay, now we're going to go over some tendon reflexes, okay? So first I'm going to do your reflexes. So for your brachial reflex, and then your brachial radial. Okay, and on the other side as well. Brachial radial, and then I'm also going to do her patellar. Okay, and then Achilles as well. And I'm going to go ahead at this point palpate her pulses. So I'm going to palpate her carotid pulse. Present. And then her radial pulses. Her apical pulse. Apical pulse is present. And then her posterior tibial. And her dorsalis pedis. They are present. And palpable, a +2, which is a normal finding. All right. Next, what I'm going to go ahead and do is we're going to go ahead and assess cranial nerve number 11, her spinal accessory. So I'm going to have you shrug your shoulders up for me. Perfect. And then move your head from side to side, pressing against my hand. Okay. The spinal accessory nerve is present. At this time, I'm going to go ahead and have you stand up for me. And we're going to go ahead and test some fine motor skills. So I'm going to go ahead and have this follow my rotation. I'm going to have you put your arms out for me, touch your nose, move your hand back, touch your hand with the other nose. Perfect. Okay. And then you go ahead and let your arms down. Okay. Now go ahead and put them out in front of you. Move your arms back. Let your arms go. Okay. And then I need you to move your wrists up and down for me. Okay. And then make a fist. Okay. Perfect. And I have you bend down to your toes. And you can observe the spine at this point. Perfect. All right. Now I would have you do, if you could, is kind of do like a frog walk. So kind of get down in a frog stance. And I have you take a couple steps forward for me if you can. Perfect. All right. That's great. And then I would do a Romberg test for her as well. So I'm going to have you close your eyes. I'm going to give you a slight shrug, okay? Okay. And that was a Romberg test, and she didn't have loss of balance. So you can back in the seat. At this time, Heather, do you have any questions for me? Okay. All right. Well, I hope that your exam was pleasant, and I hope to see you next time.